Share with you guys. I am privileged in my position with Gaston Family Health Services to help with this project and to outreach to not only churches as well as the community as far as trying to get that information out on the Affordable Care Act and answer as many questions as I possibly can and be able to assist with getting those persons enrolled. I'm going to go over a brief presentation and then we'll stop for some answers. And like Pastor Carter said, there's no way that we can get all of our answers, our questions answered tonight. So we will be back on tomorrow night at 7 again. So if you could just bear with me and let me get a little bit of information now, I may answer some of your questions beforehand. If not, then we'll try to get all your questions answered. A little bit about the background of the Affordable Care Act. The U.S. Census estimates that there are 1.5 million North Carolinians, and I'm just referencing North Carolina at this point, under the age of 65 who are uninsured or who were uninsured in the year of 2011. And that's almost 1 out of every 5 non-elderly people in the state. Within Gaston County, that means that about 35,069 persons are currently uninsured. Most people who are uninsured cannot afford to purchase coverage. The health reform law will help many people purchase more affordable coverage. Well, where will people gain that coverage from? Most people will be required to have coverage of health insurance through coverage in 2014, and we, as you know, are only a couple of months from that deadline. So in the year of 2014, most people will be required to have health insurance. The health reform law builds on our current system of providing health insurance, and that comes from a couple of different ways. Health-based coverage. Most people will continue to get health coverage through their employer. If you are employed and you in fact get your health coverage from your employer, that can continue, and that will continue. That will not be bothered at all. In fact, in most cases, your insurance coverage will be enhanced. Some people will get coverage through public coverage, which includes Medicaid and North Carolina Health Choice, and in some cases that is CHIP, which is the Children's Health Choice portion. And then others will have individual coverage, which is a non-group option. And what that is people will purchase their coverage on their own. And many will qualify for subsidies to help them afford this coverage. That is where the Affordable Care Act come in. If you know of anyone that is self-employed or someone who has just searched for their own way of getting their insurance themselves, that's the individual way of getting your own coverage. When I speak of employer-sponsored coverage, currently we have about half of our non-elderly North Carolinians that receive that health coverage through their jobs. And that's about 54%, either through their job or through their spouse's job or their parents' job. One thing with their children now, the law is increasing that age, so if your child is or was on your insurance, they actually can remain on your employer's insurance until they have their 26th birthday. So a lot of times where they had to come off where they were 23 and 24 years old, they now can remain on your insurance until they are 26. Some parents are happy about that, some parents are not. Some children are happy about that and some are not. But most people will continue to receive insurance through their employers. Now, when it comes to the employer responsibilities, employers with 50 or more full-time employers are required to offer insurance now, or they'll have to pay a penalty. What that means is they're required to offer coverage to all of their full-time employees and their dependents, whether that is your child or your spouse. Employers with less than 50 full-time employees are not required. So if you work for a smaller company and they don't have at least 50 full-time employees, then they're not required to offer you health insurance. So that means you have other options, and we'll talk about those in just a little while. Smaller employees with 25 or fewer employees and average annual wages of less than $50,000 can receive a tax credit if they offer coverage and pay at least half of the premium. And it was stated in the law that the requirement for employers to offer your health insurance coverage was slated to roll out next year in 2014. That has just been rolled back. So that requirement for them is now rolled back to 2015. However, there is still individual requirements based on the new law. When we speak of Medicaid and health choice, Medicaid is a government-funded health insurance program that covers some individuals and families with low incomes. And because of strict eligibility rules, Medicaid only covers 30% of low-income adults in North Carolina. NC Health Choice is North Carolina's children's health insurance program, and we refer to that as CHIP. It is a government-funded health insurance program that covers some children with family incomes too high to qualify for Medicaid, but no more than 200% of the federal poverty level. With Medicaid, the health reform law allows states to expand Medicaid to most adults with incomes under 138% of the federal poverty guidelines. This would provide Medicaid to an additional 500,000 North Carolinians. Well, here's our problem. North Carolina and our General Assembly decided not to expand Medicaid. So what we hoped that where it would close that gap, so to speak, where that 500,000 North Carolinians that would be eligible for Medicaid would in fact be able to get coverage, that is not going to happen at this time. We do have our fingers crossed that North Carolina will change their minds and accept the free money, but at this time they have chosen not to. They are still some 70 to 90,000 people who are already, with the current guidelines, are already eligible for Medicaid, but they have not yet applied. So if you have anyone that you know that has low income, they can't afford their health coverage, it is best to at least apply, and because you may qualify. And especially if you have a household of more than one, you have children in your household, the guidelines for Medicaid have been increased, so they very well may be able to qualify. Now, as we move along with getting everyone enrolled in the Affordable Care Act, then there's a streamlined process where when you are completing the application, then they are going to first realize whether you are eligible for Medicaid and or CHIP. So where you may not even think that you qualify for Medicaid, you may in fact qualify for Medicaid. And if you don't qualify for Medicaid, in fact your children may qualify for CHIP. So that's going to close some of the gap, not all of the gap, because there are going to still be some of our poorest of the poor that still will not be able to qualify. Okay? So simplifying Medicaid and NC Health Choice. Even though North Carolina has chosen not to expand Medicaid at this time, other provisions have been made to make it easier to apply and for the existing Medicaid. The new law is a simplified application process. We're going to be using electronic data to verify eligibility, so that reduces the need for paper documentation. Now you can also apply online, by phone, by mail, or in person. You no longer have to wait in line at DSS and wait for 2 hours. You can always go online to apply. You can have assistance from a person in person whether it be a navigator, a certified application counselor, or anyone that has been trained in the marketplace to assist you. There is a 12-month eligibility period still. So say if you are eligible for Medicaid December 1st and you actually receive Medicaid December 1st, then you will have Medicaid for an entire year, and when that year is up, then you'll be recertified. And with the new streamlined process, you're not going to have to complete a whole lot of paperwork again to be recertified. So the process is being streamlined. So when you complete your application through the process the first time, then they will get your permission to automatically do your eligibility review within that year. Remember, everything's going electronically. You thought they could keep up with us before, now they really can, because they push a button and check everything about you. So all they have to do your review is push a button, see if you still have the same amount of people in your household. Most of the time that is verified through your tax records with the IRS, what you filed on your income taxes, and also based on not only your income taxes, but based on your Social Security Administration, what you make with your W-2s. They can verify that through the Employment Security Commission. So people who receive Medicare do not, and I repeat, people who receive Medicare do not need to purchase insurance through the marketplace. Did that clear up any misunderstandings? In 2011, Medicare beneficiaries started to receive 50% discount on any name brand drugs purchased in the Medicare Part D donut hole. The legislation phases out the donut hole by 2020. Now that's a long time, at least 7 years, before we really get rid of the donut hole, but it's coming. One of the other benefits for Medicare with the new law is that January 1 of 2011, Medicare did begin covering preventive services with no cost sharing. So a lot of the new benefits that are coming into play with the new law, where you could get your preventive services without paying a copay and things of that sort, Medicare already started implementing those things in 2011. As far as the individual responsibilities for 2014, beginning in January of 2014, the ACA requires that most people have insurance coverage or pay a penalty. Now what that means is that you can meet your requirement by having either the employer-sponsored insurance, you can have the public health insurance coverage, which we just covered, which is Medicaid or CHIP, or you can purchase insurance on your own. Those are 3 ways that you can qualify or meet that requirement and will not have to pay that penalty. So responsibilities for individuals: if you choose not to go through the marketplace, if you choose not to purchase health insurance individually through your employer and those sorts of things, this is how the penalties will roll out. In 2014, or for your 2014 taxes that you will file on April 15th of 2015, the penalties will be $95 per adult in your household, or 1% of your taxable income, whichever is greater. So if you have your husband and your wife, husband or wife, and 2 children in your household, this means that your husband and your wife both will pay $95 for the penalty, and half of that penalty goes for each of your children. You have 2 children, you're going to pay $47.50 per child. And so all of that adds up, and that penalty will be adjusted in your income tax. So where you had a big tax refund, if you did not choose some type of health insurance or have an exemption, then that's when that penalty will come into play. Now that doesn't sound harsh to some people, but they're just giving us a little bit of a break for 2014, because come 2015, if you do not have health insurance, then that penalty jumps to $325 per adult in your household, or 2% of your taxable income, whichever is greater. That means that half of that penalty will also apply to each child in your household. Y'all follow me? Okay, so by 2016, guess what happens? If you choose, I know we do have some stubborn folks, but if you choose not to purchase health insurance some type of way, or have an exemption in some type of way, by 2016, that means your taxes that you'll file, Lord's willing, we're all still alive, 2017, April 15th, you will be penalized $695 per adult in your household. Half of that for each of your children. So going back to my first example, if you have 2 adults in your household, that's $695 per adult. That's almost $1,300, well, almost $1,400. And half of that per child. So if you have 2 children, you have another $695. That's almost $2,000 of penalties that you'll receive. And in most cases, you're not going to pay that much for health insurance. Because if you can't afford health insurance, then there's other cost-sharing ways to make it affordable for you. And then you may even qualify for Medicaid or your children for CHIP. So it's not sit back and see what happens, or sit back and see if I'm going to pay the penalty. The best knowledge, remember the lack of knowledge will take us down every time. The best thing to do is to go through the marketplace, see what you qualify for, and then move on from there. In no event will you or your family have to pay more in penalties than you would pay to purchase coverage. Also, certain groups, and this is probably something that you definitely want to take note of, because if you go back and share this information with anyone, please make sure you explain the penalties and the exemptions to them. I will be giving out some information at the end of our program today, so if you have any questions, be sure to contact me. Certain groups are exempt from the penalties, and those include those who would have spent more than 8% of their income for the lowest cost premium for a health care plan within the marketplace. And the way that is calculated, say that you are, you and your spouse, you're counting both of your incomes. If when you count your entire household income, if what you have to pay if you choose a plan within the marketplace, and that the lowest plan is more than 8% of your household income, then it is not reasonably affordable for you. So that will give you an automatic exemption, and you will not have to pay a penalty. So the best thing to do is go through the marketplace. People who do not have to pay taxes because their income is too low. So if you're in that line where you don't make enough money to have to file taxes in April or before April, then you automatically are exempt from the penalty. But you still have to apply through the marketplace to get your little piece of paper that says that I'm exempt. Certain people with religious exemptions or who are members of health care sharing ministries, there are ministries and groups throughout the nation that they don't take certain insurance, like from their employers or public assistance. They are a group that bundles together, and they put in their own funds, and they all pay for all of their own insurance. You cover mine, I cover yours, and they're part of that group. Not speaking of a cult or anything like that, but they are a certain group. And they have documentation with the state that that's what kind of group that they are, and they have to present that documentation in order to get their exemption. Prisoners, while they are incarcerated, are automatically exempt from the penalty. Members of federally recognized Indian tribes, if you have your certification and your membership to prove that you are part of a federal recognized tribe, then you do not get the penalty. Undocumented immigrants, that means they're not legally here. So they're not going to try to apply for the marketplace, so they're exempt. Short-term gaps in coverage. So if you have coverage with your job, you may quit your job or leave your job, get laid off, and you may have a gap in your employment or gap in coverage. And as long as you have less than 3 months, 3 consecutive months of being uninsured, then you are exempt. Once you go over the 3 months, then your penalty is going to be prorated for the time that you did not have coverage. So if you did not have coverage for 1 to 2 months, then your penalty for the year will be prorated for that 1 to 2 months. Am I losing anybody yet? Okay. Other people can be exempt if they meet a hardship requirement. Individuals who have been eligible for Medicaid in states that chose not to expand Medicaid, they will be able to get most likely a hardship exemption. Individuals who have experienced financial or domestic problems that prevent them from obtaining coverage. This may include people who experience homelessness, domestic violence, bankruptcy, death of a close family member, recent substantial medical debt, or natural disasters. And like anything else, you have to have documentation. So say a husband and a wife are legally separated now, and she was on husband's insurance or vice versa, and so now he's no longer covering her on his insurance. That's a domestic violence situation where she lost her coverage, so she can actually qualify for an exemption. Some of the key concepts that we want to remember for the health insurance is that individuals will be required to pay monthly premiums to get this health insurance. Now, some people are kind of mistaken about that. Anytime you have health insurance and it's not a publicly provided health insurance, there are insurance premiums involved. If you buy insurance from your employer, sometimes they pay for your portion of your insurance and sometimes they don't. But many times you are paying a deduction from your paycheck to get that insurance. That's the same thing here. You will be paying premiums to get your health insurance. Out-of-pocket cost sharing could include your deductibles. You may have a yearly deductible that you must pay first before your insurance pays for coverage services. You'll have a co-insurance, and that portion of the health care costs you may need to pay after you meet your deductible. We'll go over that in just a little bit. You may have co-payments, which are fixed amounts that you need to pay before you go and see a doctor. A lot of us do pay co-pays when we go in to see the doctor. And in addition, the health law includes a maximum amount of how much that you will have to pay out of pocket for covered services. So once you reach a certain amount of out-of-pocket coverages, then that'll cap off for you, depending on which plan you choose within the marketplace. There is a portion of the marketplace that is set out just for small businesses. I'm not going to go over that a lot tonight unless there's someone that has a question on that. But if you have your own business or you're concerned about purchasing insurance for your employees, then please do see me after the program, and I can provide you with some more information, and I can give you my contact information if you have any other questions. There are 4 levels of coverage that we have available, and they are bronze, silver, gold, and platinum. These are the levels of coverage that are available to you in the marketplace. With the bronze level of coverage, 60, that's kind of like a 60-40. If you've ever purchased your own insurance through your insurance provider, sometimes they're 70-30, sometimes they're 80-20, if you kind of know what that means. But with the bronze level, it is 60% that the plan pays and 40% that you pay. With the silver plan, it's 70% that the, that the plan pays and 30% that you would pay. With the gold plan, the plan will cover 80% and you will cover 20%. And with the platinum plan, it covers 90% and you will cover 10%. Now, based on the average cost of an individual under the plan, these are what the percentages are. And it definitely may not be the same for every enrolled person. Everyone's premium is going to probably be different based on your circumstances, based on what you qualify for, based on your income. So there's different circumstances for everyone. Some of the enhancements with the plans that are offered in the marketplace, all the health plans will cover essential health benefits. And I'll go over some of what those are in just a moment. Bronze or silver plans will generally have lower monthly premiums than gold and platinum plans, as we all probably guessed at that, but they will have higher out-of-pocket costs. And there's no way to really know what those plans cost until you actually get into the marketplace and see what you qualify for and see if you qualify for a cost-sharing portion as well. There are some variations in healthcare costs among the plans in the same metal levels. For example, among all the silver plans, some may have higher deductibles but lower co-insurance and co-payment requirements. Some may have lower deductibles but higher payments every time you visit your health provider. And on average, for an enrolled group of people, these plans may pay the same amount, 70% of covered services. So when you get in there, for example, Blue Cross and Blue Shield of North Carolina offers 26 silver plans. That's just silver. So it's going to be basically what you want to be covered, what you need versus what you want to pay and what you need to be covered when you go to the doctor and things like that. So you're going to have several choices. The key to all of this is you have choices. So we have to remember that. And so the best thing to do again is go into the marketplace, and that's what navigators and certified counselors are available for, to assist you when you don't understand this stuff, when you don't know what the heck it's talking about. That's what we are here for. So some of the health benefits that are offered in qualified health plans that the marketplace and these plans must cover: your doctor visits and other outpatient services. They must cover emergency services, hospitalization, maternity and newborn care, mental health and substance abuse disorder services, prescription drugs, rehabilitative services and the devices, laboratory services, preventive services, and chronic disease management, as well as oral and vision care for your children. Some plan details include, right now in the state of North Carolina, we only have 2 providers that chose to present plans through the marketplace. And those are Blue Cross Blue Shield of North Carolina, and they will be actually statewide. And then we have Coventry, which will be covering also in this area. And at this point, we were hoping that more providers would have came forward to offer plans in North Carolina by October 1st, but we don't have any just yet. Okay, as far as the subsidies, and I'm going to try to wrap it up just so we can see if we have any other questions. With the subsidies, if you qualify for subsidies, and for time's sake, a subsidy is help with paying your insurance premium. So if you go in and you actually, based on your income, your household size, and things of that matter, if you qualify for a subsidy, if it turns out that your premium for the month is $200 and some odd, and you qualify for a subsidy of $170, then the government is going to pay that $170 and you pay the difference. So if you have a subsidy, the amount of financial help will vary based on the amount of money that your entire family makes. It's based off of your entire family household income. You will be eligible for financial help if you do not qualify for Medicaid or CHIP, if you do not have access to affordable employer-based coverage, and your modified adjusted gross income is between 100 and 400% of the federal poverty level. And at this point, that's right around 23,550 to 900, Lord have mercy, 94,200. I want that, 900,000. 94,200 for a family of 4. So that's an estimate. Like I say, nobody's story is the same. So what is the best thing to do? Go through the marketplace. Y'all are listening. Okay, so tax credits to help pay for premiums. Tax credits may be available to help you pay for your health insurance premium, and those are based on a sliding scale based on the cost of the second lowest silver qualified plan. No, that doesn't make a lot of sense at this time, but it is. Limits premium payments to a percentage of your income and will be available every month to help you pay for your coverage. So say if you do qualify for that subsidy and the government is responsible for paying that $170 of your premium, they're not just going to pay it for that 1 month and leave you hanging. They're going to pay that $170 every month, and then at least for 12 months for the year, and then when you come around again for the next year, then you'll have to re-qualify. Okay. So there are some eligibility requirements as far as with the federal poverty level to see what you qualify. I do have a federal poverty level guide that I'm going to copy and bring back tomorrow. So if you're not here tomorrow, then I can leave those with Pastor Crawford, and he can kind of give you an inkling of what the federal poverty level guidelines are, because it goes all the way from 11,000 to 94,000. So just don't think if you make 40,000 that you may not be, within the guidelines somewhere. If you make 40,000, well, up to 47,000, and you have a family of 4, you're right in the middle. You're 200% of the federal poverty guideline. So don't assume things. What's the best thing to do? Go to the marketplace. Okay. All right, so my time is almost up. So at this time, I'm going to give you the special enrollment periods, and then we're going to pass out some information. I have one of my team members here, Ms. Berlina Lomick, and she's going to assist me with passing out that information. But at this time, we'll go ahead and take questions. And then if you have any questions, you can call me, email me, or you can call the 800 number that we have on this form that we're going to give you guys tonight. But like I said, if you go home tonight and you think of a question, either email it to me, call me and leave it, or come back tomorrow, because there may be another question that's asked tomorrow that you don't think of yourself, okay? So who has questions? Yes, ma'am.
I wanted to go back to talking about unemployment, because it's...
Let's do the mic. Can we do the mic?
So many people are without jobs. So my question, I heard you say something about if you're unemployed, like for the first 2 months.
Mm-hmm.
First 2 months. What if a person's been unemployed for a whole year?
Mm-hmm.
Because my first question when Obamacare came out was, if you don't have a job, how are you going to pay for insurance?
Right. It's based on your income.
But there is none.
That's right. So you will go through the marketplace. You put in your information. It's going to tally all of that up. It's going to verify that you are on unemployment. That's where your income is coming from. Were you on unemployment on your last year's taxes?
Well, it's not me. It's just that I...
Okay. Well, if it showed unemployment benefits on your last year's taxes, all of that shows up. You're not going to be required to pay for something that you can't afford. And if you don't have a job...
Okay.
Does that answer your question? Okay.
I have a question. I'm here.
We want everybody to hear your question.
I'm talking about easy, Mikey, but I hear people talking about, well, they saying that the government is trying to make them take out insurance, and this one person said to me, I don't think we should be made to take out insurance if we don't want it. Can you kind of speak on that a little bit?
I can, and as a black person, I definitely want to speak on that. Because I have a mother, and I had a father that was hard-headed and didn't want to go to the doctor. And guess what? He was diagnosed with prostate cancer, and within 3 months, he passed away because he wouldn't go to the doctor. He didn't know what was going on with his body. And when he found out, he didn't tell us. So when we found out, it was 2 weeks, and we knew my father had prostate cancer, and then he was gone. I had an uncle that was diagnosed with cancer, had never been to the doctor in 30 years. He had a boil on the side of his belly that was there since I was knee-high to a grasshopper, as they say, and all of a sudden one day it burst. And we used to play with that knot. The lack of knowledge. As a little girl, I used to play with that knot. And it was hard, then it got soft, and it was hard, then it got soft, and it burst. And he didn't think nothing of it, and I was a teenager, I didn't think nothing of it. So this man worked 70 hours a week for 30 years, took care of all of us, and one day he couldn't get out of the bed to go to work. I knew as a 20-year-old something was wrong. When I took him to the doctor, to his doctor's office, they sent him straight to the hospital. He was diagnosed with cancer on December 28th. He passed away April 2nd. Why would you not want to go to the doctor? Why would you not want to have health insurance? So, the government is not making you get health insurance. Health insurance is to benefit us. It may be that you don't want to come out of pocket to pay for something, but guess what? All of the other stuff. We spend money on hog chitlins at Thanksgiving. We spend money on cigarettes. We spend money at the bootlegger's house. We spend money at the liquor store. But we don't want to spend a couple of dollars to pay for health insurance. Oh, I went into preaching. I'm sorry. We don't want to spend a couple of dollars. He forgot to tell y'all I was Elder Tjuana. We don't want to spend a couple of dollars to get health insurance, if not for your sake, for your family's sake, for your children's sake, but for your sake, to keep yourself up. Know what's going on with your body. And especially women, if you don't know what's going on with your body, if you don't know what's going on with your body or know your body, then that's when breast cancer and ovarian cancer and all that stuff is going to sneak up on you. But now the law has made provision for all of that stuff to be required, and you don't have to pay to go to the doctor to get checked. And if you have had breast cancer before, or if you are currently diagnosed with breast cancer or any other pre-existing conditions, you cannot be turned down for health coverage. Okay, I'm sorry. I'm back. I'm passionate about health. I mean, I'm not going to tell you what I pay for a family plan, but I'm going to pay for health insurance because we went to the doctor. That's just how it is. Anybody else?
Okay, on the child, it was, if that child was in school, he could stay on your insurance.
Mm-hmm.
And so the 27, he's 27 years old now, he or she.
26.
26?
Mm-hmm. It doesn't matter whether they're in school or not.
Doesn't matter whether they're in school or not.
They can stay on your insurance until their 26th birthday.
Okay.
Mm-hmm. And then once they reach that 26th birthday, send them through the marketplace because they can qualify to get help with paying for their own insurance.
Thank you.
You're welcome. We want everyone to hear your question.
Well, I'm speaking for myself.
Mm-hmm.
Okay, I've been going to the health care for a long, the health department for a long time.
Yes, ma'am.
I pay my co-pay. Do I still got to get health care insurance on part-time or not full-time?
Are you under what we call the self-pay option at the health department, or do you go through Gaston Family?
I go through Gaston Family.
Do you receive Gaston or Health Net Gaston benefits at this time?
Yes.
You do? Okay. So if you still meet those qualifications, then you probably will be, because with the Health Net Gaston qualifications, it used to be 200% of the federal poverty level. They reduced that to 100% of the federal poverty level. So if your income still meets that qualification, you can stay there and you won't have to worry about it. But if not, then you still go through the marketplace because you may be able to purchase it and not pay anything. That's one thing I failed to mention. You may go through the marketplace and qualify based on your income to get health insurance for free because you qualify for a subsidy and you don't have to pay anything. So what's the best thing to do?
And where's the marketplace located?
You have an awesome question going on. The marketplace is www.healthcare.gov. It is on that piece of paper that you have. If you happen to speak Spanish, the Spanish website is right across from there. There's a 1-800 number, a 1-855 number on that sheet also. If you call that number, if you have questions about the marketplace, questions about coverage, any kind of questions you have, and you can't reach me, you can't get anyone, you can call that number. They'll put in your zip code and see who is the closest person to you. Right now, I haven't looked at it in a couple of days, but we are still the only organization here in Gaston County that is actually trained to assist with enrolling folks. So either you'll get myself, probably most likely not me, but I'll be helping a lot of people, but I'm everywhere all the time. So you'll get one of my staff like Belina. I have 3 people in Gaston County, 1 person in Iredell County, 1 person in Lincoln County. We have people in Bessemer City, Cherville, Catawba County. Oh God, 5 different counties. What did I forget? Davidson County also. So there's people out there to assist you. We're going to be having events all the time. You see I'm working tonight. So we're going to have events all the time. And not all of my events are going to be like this. We're going to have events where we'll come out, I'll give you the same information, and me and my team are going to go sit down with our computers and enroll you. So we'll be getting that information out. So if you need assistance, if you have questions, please, I'll be sending that information to Pastor Crawford all the time. If you're a Facebooker, I'm a Facebooker, that information will go out. If you call that number, that also will tell you where we will be at certain times so we can help you get enrolled. And it may not be that you will get all the way through the application on the first try. You may have to come back to see us more than once.
Hi.
Hi.
I have a couple of questions.
Yes, ma'am.
And when I lost my job in March of this year,
Mm-hmm.
I went to apply for Medicaid and Medicare,
Mm-hmm.
and they told me that I needed to be age 65 or older.
For Medicare?
Yeah, something like that. I have to have a handicapped child in my home to be eligible, or I have to have a baby. Okay, my child is 28 and 30.
All right. Now, did you say you applied for Medicare or Medicaid?
Medicare or Medicaid, one of the
Medicaid.
I'm not sure. Medicaid.
Probably Medicaid.
Probably Medicaid. And they told me the only way I can be eligible for Medicare or whatever, that I have to be, I mean, they can only give me once a year birth control pill, which I don't need that. You know, and that's all. I just wanted something for my high blood pressure because I didn't have a job at the time. And I wanted to continue getting my medicine. And I
Okay.
didn't want to afford it because it's expensive.
Okay.
So,
And you applied for Medicaid then?
yeah, I wanted yeah.
You need to go back through the process. First, because the guidelines have changed. I'm not sure are you making any money right now?
I'm not making any money right now. I am looking for employment because I moved from South Carolina to North Carolina.
Okay.
So now I'm looking, you know, so.
Are you, and you haven't been declared disabled or anything?
No.
Okay. All right.
What's the eligibility rules as far as
And that's for Health Net Gaston as well, right? Okay. So the best thing to do right now, because you don't have catastrophic illness or disabled or whatever, you're going to go through the marketplace again. They're going to ask you some of your employment or previous employment information. All that information can be verified, and it may be possible that you can qualify for a subsidy to pay for your insurance. But you have to go through the marketplace, because we can't stand here and, based on the information, make those qualifications. But we're here to help you. Yes, ma'am.
I can help. I can answer one other question.
Mm-hmm.
When I was trying to get my disability, I went to the Heart Foundation, and they helped me with my medication because I'm a heart patient, and I needed that medicine, and Medicaid denied me too, for the same reason she said. And I went to the heart place. It's a lot of places in Gaston.
There's assistance everywhere.
Yeah, that'll help you. Most drugs, most of the time they'll send you to most drugs. They'll pay for it, but you have to pick it up at most drugs. All you have to do is just go up there and tell them your story about you don't have an income, and they'll help you get you medicine.
Okay, Ms. Verlina does eligibility for a health net. Well, she used to do that. She can't anymore because she's mine. But she's going to give you her card, and she has a list of places that can help you also with medicine and things of that sort. But she will be able to also make you an appointment to go through the marketplace to see what you're eligible for. Okay.
I have a question.
Yes, ma'am.
For us that have grown children at home that are employed, but they don't have health insurance, when they go on to the marketplace to apply, do they use the household income or just their income?
They will put in the household names, but when you get to a certain point, it'll say, are you applying for these people? And you'll say no, because they have their own insurance. They either have Medicaid or they have their employer-based insurance or whatever. So when you get down to the nitty-gritty, it's just going to be them applying.
Okay.
And it'll base everything off of them as a one-person household.
Okay, thank you.
Okay, I'm gonna try to say something.
All right, well, you better try then.
In the last 4 years, during that time I lost my wife. And they were sending me that up here, I think it was the place where she was working, and I went up there and applied for some help, some help. And so I did go back down, which they done. Well, I made too much money back then. And so now, since I got straight, got kind of straightened out, and every time they tell me that I need to go get some help, do something, to help me do something, every time I go, they tell me I made too much money.
So what, are you going to get help for health insurance, or are you going to get help just with financially things in general?
I'm just trying to get help for whatever I can get.
Okay. Well, we probably have a list of resources for that as well, but they are going to go by your income.
That's what I want, and I hate that problem. And where I was stuck at after she passed, well, it still had me that same, doing the same thing, and I couldn't get it off. I went to one time in the place where she worked, I think she worked. I went to one time talking, and they went as far as to tell me, after they put out my stuff, I went in there and she said, started talking, she looked at me and said, ain't no need to be talking to you, you made too much money.
They know exactly what you make.
That's what I'm saying. And now, I ain't making no money.
Okay, being a minister, I visit a lot of elderly people. And I've discovered on the average, they get $600, maybe $700 a month. They can't pay their light bill, gas bill, or whatever. It's not enough to last them through the month. What are they going to do about insurance?
Does any of those people get Medicaid or Medicare, or not? They haven't reached the age to get Medicare?
They're at that age, yes.
Have they applied for Medicaid?
Well, I can't answer that question.
Medicaid.
Some have and some have not.
Okay.
Well, are you saying that if they apply?
They need to apply.
Okay.
They need to apply, And then once they get past that hurdle, if they don't qualify for Medicaid and don't qualify for Medicare, then they may qualify for a subsidy to help them purchase health insurance.
Okay.
But that's the first step, and it's a streamlined process. So if they need help with getting through that enrollment process, then we'll be able to help them with that.
But they can get it, that's the main thing.
Yes, they can apply. Everyone needs to apply.
Correct me if I'm wrong, I think there may be some undue alarm. Even as I look at this group, most people need to do nothing as far as their personal health coverage. If you have Medicare, you have veterans health care,
You're covered.
you're covered. You don't need to do anything except maybe get some information for
Right,
someone, family member, somebody want to help. But I think a lot of people are alarmed
right.
because they think they need to do something.
If you are covered in any way, you're good. Unless you you think you can't afford what your employer is offering you, then you have options. But if you get Medicaid, if you get CHIP, if you get Medicare, if you get insurance through your job, you are covered. It's the 35,000 other folks in Gaston County that's not covered that need to get on the ball. Yes, ma'am.
With the youth of 14, does Medicaid will she still have Medicaid?
Medicaid goes to age 19.
Okay, now. Okay, after that, because in a few months she will be 19.
Okay, and how does she get Medicaid at this point? Is she getting Medicaid based on
No, she was getting through social service.
was she a displaced child or foster? Okay, so once she does that, once she is no longer eligible for Medicaid, she'll need to go through the marketplace. She could very well qualify for getting a subsidy. Oh Lord, I am over time. Why did you wave at me? Okay, last question. I am 5 minutes over time.
Okay, what is this program called, Health Connection?
What is the program called? Health Connections?
Yes.
What is that? Is it a website or a program?
It's a program. Healthy Connection, that's what we call it? Okay.
Healthy Connections? I think I've heard of that, but I'm not sure what that is. I can find out though.
She said state of South Carolina.
Oh, South Carolina.